Welcome to Aging on the Suncoast. I'm your host, Jason Martino. On a daily basis, many seniors face malnutrition or hunger issues. Older adults with limited incomes and homebound seniors are faced with purchasing food or covering other expenses such as medications or household necessities. These individuals also face isolation and lack access to food resources such as grocery stores or food pantries due to a lack of transportation. During the pandemic and lingering today, isolation and a lack of access to food remains a very real issue. The Area Agency on Aging of Pasco and Pinellas partners with organizations that serve seniors within their home and within the community. Without these partners, we could not achieve our mutually shared vision of promoting independence and better nutrition while we work to eliminate senior hunger. To help us understand what types of resources are available for better nutrition and de-isolation, we've invited Anita Frankheiser, the Director of Nutrition with Neighborly Care Network, located in Pinellas County, and Tom Snee, the Senior Services Manager with Pasco County Senior Services. Later in the show, Anita and Tom will rejoin us so we can celebrate volunteerism and how critical these individuals are to nutrition programs. Before we begin, though, I want you to know that we are dedicating the show to a longtime staff member of Pasco County Senior Services. Robert Farmer, who we affectionately called Dennis, passed away recently. Family, friends, colleagues, and especially nutrition services clientele are still mourning, yet remembering his talents and the joy he brought to them each and every day. So sorry to end my monologue on a sad note, but I think we can all say that we really appreciated everything that Dennis brought to the table for the number of years that he really worked with Pasco County Senior Services. So it was very easy for me in the time that I've known him to honor him today while we talk about senior nutrition and really glorify all the things that he helped create as a team member of your team over there.
Yeah. Thanks, Jason.
Yeah, and Anita, welcome to our show.
Thank you.
And welcome back to our show, actually. You've been on here a number of times, and we're always talking about cool things. And Tom, welcome to our show. And that. So Tom, we're gonna start with you, and we're gonna talk about your organization, Pasco County Senior Services. Can you tell us what it is?
Yeah, Pasco County Senior Services was established in 1977. We're a senior services provider for Pasco County. We're local government. We're underneath the Community Services Department within the Public Services branch.
Yeah. And Anita, Neighborly Care Network?
Yep. We're a private nonprofit organization that's been around since 1966. We were actually one of the first federally funded Meals on Wheels programs in the area, and we also started adult day centers too. And now we've grown, we've continued that legacy. We have 10 nutrition sites, 3 adult day centers, and a transportation program.
Yep, and I think that actually you were one of the first in the nation during that time around there, which is really pretty honorable for your organization to start way back in the day.
That's awesome.
Yeah, it's really pretty cool. Sorry, so we hear buzzwords a lot. You know, you and I, we use a lot of jargon in our aging network and all that. But you know, one of the words that is that really transcends a lot of different demographics is food insecurity. What exactly is food insecurity?
Food insecurity basically means a lack of access to healthy, nutritious food. This could come from many things: socioeconomical factors, geographic inability to get to the food, even just not having transportation. So there's a lot of things that can go into it.
Yeah, and what's that look like in your county, Tom? Do you have
we have all different types of issues like that. We have wait lists that kind of set that up. But regarding transportation, at least with congregate meal programs, we have partnerships with Go Pasco, which is the local transportation, and they can bring the seniors right to the center, which is nice.
Yeah, that's super helpful to get them there, especially if they lack that transportation resource. Anita, is any different in Pinellas County? Is anything you're seeing that's different than Pasco County when it comes to food insecurity?
Yeah, a lot of it's the same. A lot of our clients say that the closest place for them to buy food would be a convenience store, maybe a fast food restaurant. So it's really nice that we have these services like congregate or transportation services to take them grocery shopping or to the food pantry or for Meals on Wheels.
Yeah, and you know, we've moved away from the term food stamps, and we tend to use the more governmental term supplemental nutrition assistance benefits. And sometimes people qualify for that, sometimes they don't. Sometimes the people that qualify for that, they get a very small amount, but that, you know, that little bit can really go a long way by supplementing what they're currently using to
Definitely
do
helps.
this. And I know, just because of a planner at my agency, that it's roughly about 50% of the people that are eligible for the program actually seek out SNAP benefits and apply for it. So we're always trying to do a good job and outreach those programs for that. And maybe if everybody qualified and received some benefit, it would put a little dent in food insecurity. But you all are putting little dents in food insecurity every single day.
We're trying. I mean,
Yeah.
that's what we do.
So let's talk about seniors and dietary needs. You know, with your professional background, you know a lot of the considerations that seniors have to experience during that. Can you talk about some of them?
Yeah, sure. A lot of people, as they age, their eating and digestion just naturally changes. They may have dentures for the first time or maybe need dentures. They just don't digest food as easily as they did before. A lot of them complain that they don't have appetite. And I don't know if you know this, but a lot of people lose their sense of feeling thirsty, so they may become more easily dehydrated.
I didn't know that at all.
Yeah, so those are some big concerns that I address with clients. They're also managing chronic conditions like heart disease or diabetes. So it's really important for us to provide meals that are really high in whole foods like fruits, vegetables, whole grains, protein, and low in salt and added sugar. And then our county is so diverse, and I always tell people to find foods that you enjoy eating and eat a variety of foods to get all the nutrients that are available. So we make it a point to plan vegetarian, Latin style, Asian style meals to appeal to the broad demographic we have.
That's really awesome. I think sometimes cultural sensitivity kind of gets put on a shelf sometimes when we're talking about nutrients, but it's so important for somebody's spirit and their psychology and everything else that goes along with being a holistic human being. So thank you for raising that on there. So my understanding, the Older Americans Act is one of your biggest funding sources. Obviously,
Yes.
it came out in 1965. I glorify this piece of legislation all the time on the show, but just because it does so many things in the community. Tom, tell us how the Older Americans Act programs that you're operating in Pasco County.
I would say we have two primary nutrition programs through the Older Americans Act. It's going to be our Congregate Meals program, which is our senior centers. Basically, our seniors get a chance to come in, have a healthy, nutritious meal at the senior center, and they're getting socialization while they're there, which is a huge thing. We try to work a health and wellness portion into it as to kind of go with the healthy, nutritious food. And we're always looking for volunteers and stuff to kind of run different programs, things like matter of balance classes, things like that.
Yeah. Well, we're getting ready to start to launch that in the near future. So we'll
Yes.
reach out to you and see if we can continue those evidence-based classes that you guys were offering at that shop.
Yeah.
You also have another program you
Home
mentioned?
delivered meals.
Home, yeah.
It's a huge program. Basically, we deliver for clients that are homebound. They can't get out of their homes for whatever reason. We have a home delivered meals program throughout the entire Pasco County where we bring healthy, nutritious meals to their homes.
Yeah, and going back to jargon, you know, we use in our network pretty commonly home delivered meals, but sometimes I think the world understands it as Meals on
Meals
Wheels.
on Wheels.
But they're one and the same,
Sure.
right?
Yeah.
That's what I
Yeah.
thought. Anita, you do some other components of the Older Americans Act nutrition programs. Tell us a little bit about those.
Sure. Nutrition counseling is a free service with a registered dietitian. So we work one-on-one with a client to teach them how to use food as medicine to address their health concerns. It could be heart disease, like I talked about. It could be unintended weight loss. So we'll meet with them individually. I'll assess their diet and see how they're eating, and then figure out ways that we can change their behaviors and change some of the foods that they're eating so it'll address those health concerns.
That's really great. And you do
Nutrition education.
education,
also.
that's right.
Yeah. So we plan a monthly topic that's specific to older adults, and we make handouts based on these topics that go with the back of the menu. And in one benefit to coming to the Congregate program, or what we call the senior cafes, is that you get to attend a live class with a registered dietitian. It's more interactive. You get free food samples. So just last month we were tasting papaya, and then we were giving out salt-free seasoning like Mrs. Dash for Heart Month.
Oh, that's really cool.
Yeah.
Tom, is it fair to say that you also do some of the nutrition education
Yes,
and
we
the
have the
counseling?
same programs. We do a little bit differently. We have a contract with the Department of Health that brings a lot of those services in, and we partner with them on that.
Either way, you have expertise at the table offering
Yes, sir.
really good information on there, and the counseling is super important. I want to give you all kudos. I know it's a little off script, but for the last 2 years, we've been dealing with the pandemic, and I know for a fact that you've all had to shift your gears because the heartbeat of your services is when people can talk to each other face to face. When you're dealing with isolated seniors receiving home delivered meals, or AKA Meals on Wheels. And then the congregate services were severely disrupted because that was a place for people on sunny days where they can de-isolate and enjoy each other's company over there, especially people within their own cohort. You all really bounced back from some of the setbacks that we experienced during that time. You launched innovative programs. I may have talked about it last year, but I still think it's worthy to talk about this time too. So we, as an area agency on aging, and obviously Pasco County and Pinellas County, are really proud of the work that you did on there.
Thank you.
Now we're going to fast forward into eligibility. So let's talk about that. I know for a fact that Older Americans Act programs are free, but what other kind of eligibility factors does someone have to think about when trying to get in your nutrition programs? Tom?
Sure, yeah. Basically, we're looking at 60 plus years of age, and then they receive an assessment to determine that eligibility after they qualify for that. But once someone is determined eligible, as for congregate meals, let's say, they want to come to the senior center, the spouse of an eligible senior is also qualified. And then if that senior has a disabled adult that they're taking care of, that disabled adult would be qualified as well.
Yeah, so that's a pretty cool little factor right there. They don't always have to be 60, but if they're caring for an individual.
Correct.
Yeah, okay. Anita, anything else to add in that?
No, I know that volunteers at a congregate site can also attend the services as well. Yeah, that's a nice benefit to volunteering too.
Yeah, that puts a lot of things into perspective. Tom, you and I were talking not too long ago about congregate, and I believe that you said that you are still operating some drive-throughs for some of those folks that maybe still unsure or a little bit more reluctant to get back in the community. Is that true?
Yes, sir. So the way the drive-throughs came about for me to begin with was at the beginning of the pandemic. We realized it was just actually back on 2020, March 16th is when we closed all of our sites because of the pandemic. So one of our really innovative senior center coordinators, her name is Carolyn Johnson, she calls me up and says, Tom, what are we going to do? And I'm like, well, we're going to have to figure something out. So I'm like, well, so then she says, well, if McDonald's and Burger King can run a drive-through, why can't we? I'm like, this is a phenomenal idea. This is great. So at that point, I reached out to AAA, went through it, said, this is what we want to do. What do you think? They said, we love the idea, ran it up to Department of Elder Affairs. They approved it. Within 48 hours, we had one open. And we were able to, with literally a 2-day gap, we were able to keep serving everybody that we were serving prior to the pandemic for congregate meals, and then opened it up and delivered hundreds of thousands more meals throughout the pandemic than we would have been able to had that not happened, had we not opened the drive-thrus. So it was really cool.
That is crazy. And I know that some of the innovation you're doing was working with some restaurants and all that. And,
yes,
and I do,
dining out at home program.
Yeah, and I do recognize that that was a blip in time, but really it was just saving people's lives, I think, back then by trying to be as innovative as possible. And I guess I should extend my kudos to the Department of Elder Affairs because they really supported a lot of our innovative efforts on the ground, where generally there are rules and regulations that we follow on a daily basis, but they were willing to serve people where they're at. How do we get a hold of your programs?
Pasco County Senior Services, 727-834-3340.
Awesome. Nita?
And Neighborly Care Network, 727-573-9444, or our website.
Yeah, and just because we don't expect everybody to remember that we have graphics that we're going to be running at the middle of the show and at the end of the show, and that will definitely help you, so have your pen and pencil ready. I'm trying to think about some other available resources. I mean, you guys are supplying congregate meals, and you're supplying the home delivered meals, and you're doing the counseling, and you're doing the nutrition education. Are there other things that you're providing to them, like wraparound types of services? We talked about food insecurity, and I know that that's really heavy on your minds as well. What are we doing that's to wrap around things?
So I kind of touched a little bit about on transportation. A lot of times, and this gets out of what we provide directly, but we have partnerships all over the county. With transportation, a lot of times our seniors wouldn't be able to get to a senior center without a ride there. So we have paratransit contract that is also funded through the Older Americans Act that will ferry the folks to our senior centers.
Yep, and once they're linked up with transportation, and similar to Neighborly offers transportation, they can usually get linked up for medical appointments and then also shopping assistance if they need to get to a grocery store and some other things as well.
Or food pantry.
Yeah, exactly. So happy you're on the show, and I look forward to talking with you in the second half of the show too. Please stay with us while we take a short break. As usual, don't forget to have your pen or pencil ready. During the break and at the end of our show, we'll be running contact information for Pasco County Senior Services, Neighborly Care Network, and the Area Agency on Aging Helpline.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.
Welcome back to Aging on the Suncoast. During the first half of the show, Anita Frankhauser and Tom Snee helped us understand who their agencies are and how they promote better nutrition for Pasco and Pinellas County seniors. Let's revisit with Anita and Tom so we can speak in depth to volunteerism and how critical this is within the senior nutrition programs. Anita, Tom, welcome back to the second half of the show. Such a large break we had in between the first and the second half. One of the things that we were talking about during that time is the necessity, the criticalness of having volunteers with your program. They're the backbone of your program. They just do so much in very large ways and very small ways that all add up. So why do we need volunteers in our programs? Let's tell the audience why we do.
Yeah, volunteers are our organization. Like you said, they're the backbone. We couldn't serve the nearly 2,000 people we do in a year without volunteers. We just don't have the resources and the paid staff to be able to provide that much service every day.
Yeah, and so what should a volunteer be thinking about in order? So if I was had some time on my hands and I wanted to apply it in a good way, and I just love seniors and wanted to work with them, what should I be thinking about before I approached your agency to see what opportunities you had?
Yeah, definitely think about what your passions are. What is your why? If you're passionate about nutrition and older adults, hunger issues, then our organizations are a really great opportunity for you.
Yeah, I had brought this up during a meeting I had with our Shine volunteers, and we were talking about that a little bit during the show, and all the points that we wanted to talk about today were so fitting to the volunteers that I work with. We have 50 volunteers that work at the Area Agency on Aging, and they help seniors kind of navigate the complexities of Medicare. And we've had volunteers that have been with us for sometimes 1 year, sometimes 5 years, and going on 15 different years with this show.
That's great.
And I mirror everything that you all talking about and highlight the importance of them working. But they think about different things. One of the points that we all talked about is if they're able to be a team player, because they're working with people in their cohort, right?
Yeah,
and then also with management sometimes, and we want to make sure that they're safe and they do everything within the regulations. And we also definitely recognize that at some point in life, you just want to give back. You've worked all your life, and you just want to be able to give back. I imagine that's the same with the volunteers you work with.
Yeah, absolutely. They just want to stay connected in the community.
Yeah, and I imagine that they also create some pretty cool relationships there as well.
Yeah.
If you're serving 2,000 people, that means that you need a core of volunteers to do that. So I imagine
Small army.
Oh yeah.
Yeah, absolutely.
Yeah. Same on your side in Pasco County, Tom?
Yeah, not as many. We got about so we don't do nearly as many meals. We do about 1,200. We serve about 1,200 a year.
That's nothing to sneeze at.
No, I know. And we also have a large group of county employees that do a lot of the driving. So we don't rely as heavily on the volunteers for driving. We do somewhat, but not as much. We have about 60 volunteers that we're currently working with right now. So yeah, it's a huge part of our organization.
Yeah, that makes sense. So volunteers really augment a county system over there as well. Tom, let's stay with you. And what type of individual is generally one of your volunteers?
We got all shapes and sizes. My predecessor, Diane Bird now, she remarried.
That's right. Remember her well.
She retired, couldn't stay away. Now she comes volunteers, does a route once a week on Tuesdays. My dad is a volunteer. He comes in, he breaks my chops. Everybody loves it when he comes in because he does nothing but criticize how I'm doing things. So you know how dads can be. But everybody that brings a skill or even just wants to help, is welcome.
Well, your dad sounds like my dad. I guarantee if I brought him into my professional environment that I would have to ignore a lot of his things.
Antics.
It's the beauty of parents, right?
Yes.
We had no choice in that matter over there. Anita, anything to add to some of the types of volunteers, the individuals that you see in?
Yeah, well, our board of directors is all volunteer, so that we can leverage their expertise and their experience in business and banking. We have a computer teacher who teaches basic computer classes. And then certainly with our biggest program with nutrition, our volunteers who pack are very essential, as well as people who deliver every day. It only takes an hour and a half to 2 hours to make a difference.
Yeah, and that's enough, you know. I know those folks get there pretty early in the morning. They're getting all the food together. They're packing it in a safe way. They're keeping the compliance measures with the temperature on there, and then out the door for the next volunteer to take it off, and then have eye-to-eye contact with those people in the community. Every position is super important on there. I know that.
Another thing that's really big for us that we're always trying to find volunteers that have a unique skill set. Like somebody knows how to teach line dancing. Maybe they can play the violin, anything. If they're willing to come in and teach a class, somebody might be interested in that. You know, and so we're always looking for kind of outside the box ways to employ volunteers. So anything that they can bring, we try to.
We started a new program where we have volunteers taking clients to medical appointments and picking up prescriptions even.
Oh, that's awesome. So you
That is
never
an
really
awesome
know what
program.
somebody brings to the table until they present themselves to you, and you get to ask them good questions about what they can, and then you appropriately place them to where you think that your agency needs the most help. You also have corporate sponsors that help out with that. Is that still correct?
Yeah. We've had over the years Publix, Raymond James, and other church groups adopt a route throughout the week.
Yeah. So Tom, I think I asked this in a different way too, but well, actually, you've already really answered it. I was going to ask what type of individual generally volunteers, but is it seniors, or is it you're getting people from all
so
different
not
ages?
always, but the majority of our volunteers are seniors. They've retired and they want to come back and give something to the community.
Yeah.
And it's they're volunteering with their peers, so it's pretty neat.
Yeah. So let's talk a little bit more about the activities that they would actually do with your.
Sure.
Tom, you got a C1, C2. I'm sorry, I used jargon again. Our home delivered meal program and our
home
congregate
delivered meals. Yeah.
What would they do in these programs?
So for congregate meals, we kind of talked about already activities, right? So that's kind of one thing we're looking at. But as far as the meal service itself is concerned, they'd help out in the kitchen. They might help out packing, like when we're talking, because that's part of the congregate program. You know, we stage our home delivered meals as part of our congregate operations in the morning. So before the clients come in. So then they might serve the meals as well. And then kind of stepping away from that a little bit, we have some volunteers that answer the phone and some administrative volunteers. And we're really looking towards the future of kind of employing volunteers to do outreach, which is something that Anita and Neighborly do very well. I kind of model a lot of things that we do off of the things that Anita does, because they're really good at it.
Thank you.
Oh, that was really cool for you to say that. We've talked about this before. It's still an issue. That a lot of times you'll deliver food to somebody and they may give some of that food to their pets because they're having a hard time doing it.
Thank
and
you.
you were working with an organization in Pasco that helped with that. Talk a little bit about that.
So Cindy's Pets is a charitable organization in Pasco County that, exactly what you said, a lot of times our seniors will give away their part of their meal to their pets. So this organization got together and said, we want to help. And there's over 300 clients per month that they'll deliver pet food to help offset that need, because they're low income. They might not have the money to purchase regular pet food for them.
That's such a big help over there.
It's awesome.
And Anita, you and I a week ago were talking, and I don't pretend to know everything about everything, but I know that it was the computer classes that people were being helped with over there?
Yeah, we have a volunteer, Tony, who teaches basic computer, like how to turn it on even. This is the keyboard, the mouse, Office 365, how to make a spreadsheet. It's really been helpful for even our staff to learn about.
Wow,
How to
really?
use the
Maybe I
computer
can
better.
get some
Yeah.
lessons from him.
Yeah.
That's some shared knowledge going on there too. Let's talk about impact. Certainly we know that putting a qualified individual into a volunteer individual into position helps out the bigger machine that we operate here too. But what's the impact that you understand that volunteers bring to the table for your organization?
So last year we had just over 1,000 volunteers provide service, and that was almost 50,000 hours in equating to about 1.4 million in savings for us.
Wow.
Yeah.
That's sort of the monetary impact,
Yeah.
and then and the man hours, the people hours, we'll say,
Yeah.
that they put into it is quite considerable. Tom, what about you?
Yeah, this is where you can really see we're significantly lower than that. We're about $125,000 last year is where we were, but it's a huge help to us, and it gives us something to aim towards.
Yeah. So let's talk about the inverse. What does the art of volunteering, what kind of impacts does it have on the actual volunteer itself?
So people come to us because they want to help, but then they end up staying because it's just so rewarding. You have that direct, immediate impact, that sense of meaning from giving meals or helping other people. And people who volunteer regularly actually have better health outcomes. They have lower rates of depression, and they're just healthier overall.
Yeah. Tom, anything to add to that?
Yeah, I mean, you remember John out at the Galen Wilson Senior Center. Here's
can I forget
here's a
him?
guy that he was blind and deaf, and he worked for over a decade at the Senior Center just to have some sort of purpose. I mean, it became his home away from home. He'd actually look forward to coming in just to hang out with people because he had nothing at home. He couldn't see. It was very difficult for him, and then he had to retire from volunteering at one point, and it was very difficult for him. We had a big farewell party for him and stuff. But
He was quite an amazing
Yeah.
gentleman. I would always visit you guys maybe twice a year, maybe 3 times a year if I was lucky, and he would know every detail about the last time I was there.
Yeah.
And I assume that he would transcend all of that knowledge to all the other participants that he met as well.
Yeah.
Is there camaraderie going on here as well? Because
yeah.
I'm going to take a big guess that if you're having senior volunteers and your services are also serving seniors, that there's probably some relationship building going on there too, right?
oh yeah,
Absolutely.
Yeah.
we've actually had volunteers and congregate members get married. You know, it's really interesting.
Oh, that's really
Yeah.
awesome. Yeah.
It's neat.
So let's talk about your needs. What are your needs for volunteers today?
We could never have too many volunteers.
Same.
We always need people to help pack, help deliver, make phone calls. If you have a skill set, we'll find you something to do with us.
No
Yeah.
doubt.
Same exact thing. Yeah, we're always looking for more, and especially for us, we're trying to get some more engaging activities. So if you have a special skill set or something neat you want to share, we're the place to come. You know,
Yeah,
it's-
and I imagine, like much in life, there's ebbs and flows to it
Yeah,
as well.
of course.
I can probably guarantee that you have seasons where people may come down here to the state of
Snowbirds.
Florida and
Yeah.
stay, and
Sure.
they may want to give their time, but they end up going back up north at one point in time. So
Yep.
you're trying to fill those gaps. So
Yeah.
anyone in the audience that wants a volunteer opportunity, these 2 great organizations are definitely going to help you fulfill your needs like that. It was so nice to have you guys on the show again. We talk about some incredible things. You're all doing some really great things in Pasco and Pinellas County, and so proud to have you here.
Thank you.
Yeah.
Thanks, Jason.
We hope this month's broadcast was informative. We wouldn't have these resources without great organizations like Neighborly Care Network and Pasco County Senior Services. We also can't thank volunteers enough for everything they do each and every day. We'll see you next month, and until then, please make every use of the food resources we showcase today. And if you are looking for a volunteer opportunity, these organizations will gladly take your call.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337.